All right, it is 10:03 now, and I want to thank you for joining us this morning for this webinar about why behavioral health advocates need to know about Medicaid expansion. Medicaid provides comprehensive health coverage, and the expansion proposed by Governor Kasich will help many people with mental health and addiction needs. The purpose of this webinar is to bring you up to speed on what's currently going on with Medicaid expansion in Ohio and explain why this expansion is so critical for people with behavioral health needs. Ohio Citizen Advocates for Chemical Dependency Prevention and Treatment is partnering with Ohio Consumers for Health coverage today to present this information. Today you'll be hearing from Kathy Levine, co-chair of Ohio Consumers for Health coverage and executive director of UCAN Ohio. Donna Conley, CEO of Ohio Citizen Advocates for Chemical Dependency and Prevention and Treatment, will also be presenting today. My name is Alyssa Chenault, and I'm the Communications Manager for UCAN Ohio. I will be moderating this webinar and fielding questions at the end. And I really want to thank Donna for inviting us to present on this topic. So first things first, if you have any questions right now or at any point really during the webinar, please submit them in the questions box on the right-hand side of the toolbar. If you happen to not see the toolbar, click the red arrow. That will expand the toolbar so it's open or closed throughout the webinar. And feel free to submit those questions as they come to you. There's no such thing as a dumb question. And that will ensure that we have a buildup of questions to ensure an easy transition into the question and answer period. So let's get started. And first, we will hear from Kathy Levine. Kathy?
Thank you, Alyssa, and thank you so much, Donna, for helping us set this up. I'd like to start off at the beginning because we don't know who understands what, and the world of healthcare has gotten so incredibly confusing. So first of all, what is Medicaid as opposed to Medicare? Medicaid is a federal state program that provides comprehensive health coverage, including mental health and addiction treatment. It covers certain groups of people today in Ohio: children, pregnant women, parents, people who've been found to be totally disabled under Social Security standards, and older adults needing long-term care. But it doesn't cover people who don't fall into one of those categories, no matter how little income they have or what health needs they have. Next.
Okay.
So in 2010, Congress passed the Patient Protection Affordable Care Act, sometimes referred to as Obamacare, but we prefer the initials ACA. And the Affordable Care Act sought, among other things, to expand affordable coverage to people who are now uninsured. For low-wage workers and people with other people with low incomes, Congress enacted an expansion of the Medicaid program to all low-income adults under the age of 65 who have incomes at or below 138% of the federal poverty level. And we'll talk more about what that means in real life. And so under the Affordable Care Act, those folks are all low-income adults are eligible for Medicaid. In last spring, the Supreme Court issued a decision upholding the constitutionality of the Affordable Care Act, but in a surprise move, the court removed the penalty against states that refused to implement the expansion. So when the court took the penalty out, the states have interpreted the Medicaid expansion as optional. So state by state, states are deciding whether or not to expand Medicaid. Next. Governor Kasich announced right after the Supreme Court decision that he would look at the matter objectively. His administration did a very thorough study of the pros and cons of expanding Medicaid. did an economic analysis of the impact of the Medicaid expansion, and on February 4th, the governor introduced his state budget, and it included the expansion of Medicaid in his state budget. He has joined 8 Republican governors who have decided to expand Medicaid. So let's talk a minute, before we get into what the Medicaid expansion does, let's talk just for a second about Ohio's budget process. The governors, once the governor introduces his proposed budget, it goes to the House of Representatives. And the House of Representatives is now considering the governor's budget, all the things in the governor's budget, the Medicaid expansion, his tax changes, education funding, everything. And the Medicaid expansion is being heard by the House Health and Human Services Subcommittee. That subcommittee will vote on the Medicaid expansion on April 8th. And they'll vote on the whole budget on April 8th. Then their recommendations go to the Ohio House of Representatives, and then the Ohio House of Representatives will vote on the entire budget around April 15th. When the House votes on the budget, they can't just say no to this provision, yes to this provision. They vote for the whole budget up or down, which makes it complicated. So after the House approves their version of the budget with all the changes the House will make in different provisions, their budget goes to the Ohio Senate. The Ohio Senate then looks at their budget and considers what the governor proposes, and they come up with the Senate version of the budget. So then you have a House version and a Senate version. Those two versions go to conference committee, which is made up of representatives of the House and the Senate. They resolve their differences in conference committee, and then it gets voted on by both houses, and then the governor must sign the budget by June 30th because the budget goes into effect July 1st of 2013. If they don't have an agreement by June 30th, they'll have to pass some kind of continuing resolution because the state has to have a budget at all times. But generally, they get it done on or before June 30th. Next. Alyssa?
Yep, it's just taking a moment.
Oh, technology. Sometimes our friends, sometimes not. I guess I could cheat and look at my paper and see what's next.
It's up.
Oh, okay. So, is this Donna's yet?
No.
So, who would be covered by this Medicaid expansion? I said that it covers people under the age of 65 with incomes below 138% of the federal poverty level. This chart shows what that means. It goes by family size. So if you are an individual with no other family members and you're working full-time with an hourly wage of $7.62 or monthly wages of $1,322, or an annual earnings of $15,856 or less, you will be eligible for this program. For a family of 4, the income goes up. So think about anybody that you're working with who has income at or below this amount of money, they would be covered by the Medicaid expansion. Done? So now we're going to turn it over to Donna to talk more about who will be newly eligible for Medicaid.
Great. Thank you, Kathy, and welcome to the webinar. Ohio Citizen Advocates is particularly interested in supporting Medicaid expansion because it will mean an opportunity for so many people in need of treatment and recovery from addiction to have coverage. You may remember that there once was a very small, meager benefit for childless adults to assist them in getting treatment. and some cash assistance, but that was taken away about 8 years ago. So since then, they have had no coverage whatsoever to meet any of their health needs, including access to treatment for addiction. And one of the biggest barriers for those folks in Ohio who need treatment is that they have no coverage. And there are no programs at the moment that provide any assistance in this area. And of course, without a payment source, they can't get into treatment. Some people are fortunate to live in areas in the state where there are local levy funds, for example, that help underwrite the cost of their treatment. But even those folks still have no source of coverage for the other health care issues that they frequently have due to their addiction, related to their untreated addiction, or just general health issues that most people have. So they have been unable to access care for either addiction treatment or physical health care. Expanding Medicaid coverage will provide the opportunity for that significant group of people with substance use disorders to access care and treatment for the whole person, not just for addiction, but for the whole person. And that means, of course, to us that it gives them a chance for recovery. The next slide summarizes what I've just said, the benefits of, are we on the right slide here?
Yep. Go back, Alyssa.
Thank you, that's it. To summarize what the benefits will be to the population that Ohio Citizen Advocates is particularly interested in is that it will provide access to coordinated preventative care. It will mean a reduction in serious illnesses that occur from not being able to have preventative care or being able to manage their addiction, which of course is a chronic health condition. And it will also mean a decrease in the high costs associated with treating certain of those conditions. Because right now, the only option for a person with no health coverage is to seek care in an emergency room department, which, as we know, is the highest, the most expensive alternative for them, because without coverage, they don't have access to things like a primary care physician, like most of us do. So the costs will go down. Next slide. The expansion of Medicaid to this to a broader population of eligible folks is really a rare opportunity to expand access, not just to folks who are in need of treatment for addiction, but also people with mental health disorders. It means a better chance for people to receive needed treatment for both of these disorders. And in the long run, it will help people get well, be able to manage their chronic conditions, go back to work or stabilize their employment, and also stabilize their family situation. Next slide. So another benefit of expanding Medicaid is that it will free up state and local levy funds that are now used to help subsidize those folks who need treatment but don't have a payer source. It will free up that money so that it can be used in other ways to support recovery, such things as housing and employment, skills training, and a whole host of other alternatives to support people maintaining and sustaining long-term recovery. Next slide.
Okay, now we're going to turn it back over to Kathy Levine to talk about more reasons why Medicaid expansion is a good idea for Ohio.
Well, one of the big questions for the Medicaid expansion is who's going to pay for this? We're talking about expanding coverage to an estimated 275,000 Ohioans in this biennium alone. It turns out that, well, first of all, currently Medicaid, because it's a state-federal program, is paid for with matching funds. Ohio, actually, I think this slide has it backwards. Ohio pays, in 2013, 36% of the cost, and the federal government pays 63.58% of the cost. You know, roughly, it's historically been Ohio pays 40%, the federal government pays 60%. And that's a good deal for Ohio, but it's still a lot of money. So if we were to expand Medicaid under the current matching rate, we would have to come up with hundreds of millions of dollars. However, for the people who become newly eligible for Medicaid because of this expansion, Ohio will pay zero of the cost for the first 3 years. In 2014 through 2016, Ohio pays zero. The federal government pays 100% of the cost. Then in the following 3 years, Ohio's contribution goes down. Ohio pays an increasing contribution going up to 10% for the year 2020 and for the future. So after 6 years, Ohio will pay 10%. The federal government will still pay 90%. So there's been a lot of economic analysis. Can Ohio afford to pay this in the outlying years? And the analysis shows that Ohio will, in the outlying years, come out even or a little bit ahead with this expansion. But in the years 2014 to 2019, Ohio will come ahead by $1.4 billion. Next slide. So the benefits of the Medicaid expansion are that it actually will boost our economy because it's going to bring in an estimated $1.4 billion into our state budget, plus bring in, you know, Medicaid is paid directly to healthcare providers. And when those healthcare providers receive all this extra money for seeing people, for treating new patients, that creates economic growth. It will also create jobs, an estimated 33,000 jobs over 6 years. And, of course, it's going to promote healthier Ohioans and strengthen the health of our workforce. Next slide. So what happens if the Ohio General Assembly decides not to expand Medicaid? Well, we talked about 275,000 people getting insurance in the first biennium alone. Close to 500,000 people are estimated to be eligible who will sign up over succeeding years. So if we don't expand Medicaid, we're talking about 500,000 Ohioans who will remain uninsured. And my guess is that people on the phone know who some of those people are. We will be losing over $20 billion, around $23 billion in extra federal funding over a six-year period that would have been coming into Ohio. The governor built the Medicaid expansion into his biennial budget. Pulling out the Medicaid budget, pulling out Medicaid from the state budget will leave a $404 million hole in the proposed budget. and lawmakers would have to come up with the money to fill that hole. And it scares me to think about how they're going to do that. Next slide. So the Medicaid expansion, when you look at it, the $23 billion coming into the state over 6 years, and what it's going to mean to the economy, what it's going to do to local hospitals that now provide uncompensated care and pass those costs on to paying customers through cost shifting and, and programs having greater ability to serve people, having a payer source for treatment. We didn't mention that this equals $105 million in new money to the behavioral health care system. Because of all these benefits, the Medicaid expansion has led to the creation of a coalition of unprecedented breadth. The Ohio Alliance of Health Transformation is a statewide coalition that came together to promote the Medicaid expansion, and it brings together the local chambers of commerce from the major cities, the Ohio Chamber of Commerce, all healthcare industries, the insurers, the medical association, the hospital association, behavioral health advocates, consumer advocates. You've got Right to Life and Planned Parenthood supporting it. I mean, it's an unprecedented coalition, labor unions of people who are usually at odds with each other. And we have regional Medicaid expansion coalitions. Every imaginable stakeholder group is working on this. However, the Medicaid expansion is still risking defeat in the House of Representatives. There's serious opposition to this expansion, and the opposition is based on lack of trust in the federal government. There's concern that the federal government will renege on its pledge to pay 100% of the costs. The governor, in response to that, put a trigger in the legislation so that the expansion would stop if the federal government changed, lowered its contribution. They still say they don't trust the federal government for this and that reason, and there's concern, with the great the federal deficit. How are we going to, that this is money that should go to the federal debt. The money that's paying for the Medicaid expansion was built into the Affordable Care Act. It's not clear that that money could be used to pay down the debt, the federal deficit. But even if it were, it's really a drop in the bucket of the federal deficit. And would likely, it could go to other states. And this is federal taxpayer money that was set aside to help Ohio. And it's a tool to help Ohio in really concrete ways. So there's serious opposition. There's also, in the House, not a great understanding of who will be helped by this. And what we need more than anything is for people who either could be helped by this or people who work with people who would be helped by this to come forward and tell personal stories. I think once people hear that treatment works, that addiction treatment turns around lives, that will soften opposition to this. Next slide.
Okay. We're going to open it up for questions. We have a couple submitted already. In order to submit questions, just type them into the questions box on the right-hand side of the GoToWebinar toolbar, and we will ask the questions of our experts here. All right, so we have a first question, and it says, is there any provision that Ohio insurers must recognize addiction credentials like LICDC, etc.?
Donna, do you want to take that?
Sure.
I will try to answer that. I know that that is a concern among treatment providers. I've heard it a number of times before. What I can say is, based on what I know, and I don't pretend to have all the answers, especially on that issue, I don't believe that that issue would be addressed under a Medicaid expansion any differently than it is under our current Medicaid program. There may be some opportunity to negotiate that particular issue when the federal government comes into Ohio and establishes an insurance exchange marketplace, but I really can't give any definitive answer on that other than to say it hasn't really been addressed until now. Kathy,
right.
If you can add.
Yeah, let me add to this. This is not an area I know anything about, but I know that we have scope of practice and licensure recognition issues all over Medicaid. And there's a conversation going on with the Ohio Medicaid program about the need to expand, access to more providers. And so I think this is a field that around which there's going to be a lot more discussion. A lot of behavioral health, the behavioral health community in general is in discussions with the administration about the need to make sure that more providers are recognized as reimbursable under Medicaid. So I think this is a perfect time to be, after the budget is a perfect time to be having the discussion once the expansion is approved. And many of us have the same questions, but recognize that we've got to have the expansion happen first and then talk to the administration, talk to the managed care plans, because these people are going to be enrolled in managed care plans, and figure out how to address these issues.
Okay, and the next question we have is, how will people who already get treatment for addiction services who are currently uninsured, how will Medicaid coverage benefit them?
Well, if and when Medicaid is expanded to cover those folks, then who are eligible, then Medicaid can take over payment for those services. Somebody is paying for their services right now, whether it's the local alcohol, drug, mental health board, whether they may even have some private insurance, limited benefits. They may be trying to make payments to the treatment provider. But when Medicaid expansion happens and they become eligible, then Medicaid will pick up the cost of their treatment.
And not only that, Medicaid will cover their non-behavioral health costs.
Exactly.
And, you know, one of the most painful, tragic statistics around is that people with behavioral health, including addiction conditions, die 25 years earlier on average than other people because of untreated health conditions. You know, even if you're getting addiction treatment, you may not be getting treatment for your hypertension, for your chronic health, you know, for your diabetes and other chronic conditions, which eventually may kill you. So,
exactly.
So getting into comprehensive health care is so important.
Okay, thanks for that. The next question we have is, starts with a statement and then a question. People with addiction disorders as their primary health condition are not eligible for Social Security disability or Social Security. Will they be eligible for the expansion?
Absolutely.
Yes.
The Medicaid expansion is for all adults who are residents of Ohio.
Right, and whose incomes are within those guidelines. Yes.
Right. So they'll be eligible,
Okay,
which is
great.
very exciting. And because, you know, I just want to mention something a number that we didn't have in the slides. The analysis is that because so many people are going to be eligible for Medicaid to pay for treatment, it's going to free up local dollars, levy dollars, and local funds that come from the state government, equaling a net gain of $105 million over the biennium. This is the single biggest investment in behavioral health that we've seen from the state of Ohio.
Right.
So this goes through, yeah. Go on, Donna.
If I could just add to that, what the estimates are that I know Kathy said about $105 million over the biennium, the 2 years of the budget. But the estimates that I'm hearing are that means about $70 million every year in additional revenue that could be freed up at the local level to provide those other kinds of services that people need to support their long-term recovery. And that is incredibly exciting.
Right. Yes, the $105 million, it's $35 million in the first year because it only starts up in the second half of the year. But then you're right, it's $70 million a year.
Okay, the next question we have is, will prevention be affected by the ACA? And if so, how?
Well, prevention, Donna?
Yeah, certainly. Well, let me think about this here.
I can talk about it in healthcare in general while you're thinking. I mean,
well, that's where I was going.
Yeah.
It is certainly a piece of the Affordable Care Act, yes. And we have initiatives going on in Ohio through a couple of coalitions and organizations to help try to figure that out. Where does prevention fit in? How can we maximize that in Ohio? But that is tied more to the broader Affordable Care Act as opposed to Medicaid. But there are prevention, especially as it relates to health conditions. There are covered services in Medicaid.
No, absolutely.
For prevention.
Right, and I think the Medicaid, under the governor's administration, the Office of Medicaid Assistance has strengthened requirements of the Medicaid managed care plans. You know, people who get on Medicaid will be enrolled in managed care plans. The managed care plans are under much stricter requirements to demonstrate health outcomes, and the way to do this is through prevention. So they're, you know, it's really in their economic interest to do a better job at coordinated primary care, which means getting people into health care for preventative services and not just waiting till people show up very sick. So, and engaging patients more in their care, making sure they get preventative screenings, making sure that they're making changes in their lives to improve their health care. So we should see, even in the Medicaid program, as well as in the whole health care system, a move toward prevention, because that's one of the strategies for lowering health care costs.
All right, the next question is, will recovery supportive services be included in the coverage under Medicaid expansion?
Donna?
Okay. Again, going back to some things that we've already talked about, how Medicaid expansion will free up dollars that are currently being used to pay for treatment. They will free up local dollars, state and local dollars that can be earmarked now for support services. That money will flow to the state money will flow to the county boards as it does now, and then the local funds are typically levy dollars. The local planning authorities, the boards, will then have the ability to decide what kinds of services they will purchase with those new dollars. So to answer your question, it is at the board's discretion, based on community need and community input, to determine how what recovery support services are purchased or put into place. So we mentioned a couple, like the need for housing. For the addiction community, that means to me sober housing availability. It could be things like employment skills training. It could be parent education. It could be the provision of peer support services. But those decisions will be made locally. And I want to stress that because that is another reason why it is so important to make your voice heard as to what is needed in the recovery community at your local level. Because when Medicaid is expanded, then boards will be taking a serious look at their options as to how to use those funds. And it's important that the addiction recovery community makes their voices heard about what they need.
And that is so true. How I do want to throw out an additional thought on this issue, though, that the Medicaid managed care plans, who are now going to be responsible for the health care of, of people with addiction disorders and other problems, they are being paid a capitated rate to manage their health care. And theoretically and in reality, that gives managed care plans some flexibility. So for instance, in the past, when the state has put co-pays on prescription drugs, all of the plans have refused to collect the co-pays because they figured out that charging people with low incomes a few dollars for a prescription might mean that people don't fill the prescription. If they don't fill the prescription, they get sicker. It ends up costing the managed care plan more. So if, the managed care, it may be that at some point the community, the recovery community, may want to be in dialogue with the managed care plan about helping out to provide, to help support some services if that relatively small investment in certain recovery services can keep people out of the hospital.
Exactly. Excellent point.
Okay, the next question we have is, will Medicaid preempt existing coverage for low-income vets?
Such as the benefits they receive from their service?
Well, the answer is they'll be eligible for Medicaid, and some veterans have very limited benefits depending on what their classification is. So the Medicaid expansion actually will provide help to many veterans and also to their families.
Okay. That looks like all the questions that we have at this point. If you have any questions we haven't answered that you'd like to submit, go ahead and submit them in the questions box on the right-hand side of the toolbar.
And on the question of veterans, I just want to say that that's a great question. This is a population that can be very difficult to reach, and there's concern in the national Medicaid advocacy community that veterans who are eligible for Medicaid are not going to know about it and not want to sign up for them. And so, you know, folks on the ground, like the people on this call, who are working with veterans, are going to be very important for helping veterans to take advantage of this new benefit. You know, we've talked a lot about the need to step up to the plate on the Medicaid expansion, but we haven't talked about the challenge, once the Medicaid expansion happens, of getting people enrolled. And that'll be a conversation for a later date.
Okay, we got one submission while you were explaining that.
Sorry.
That's right. No, great. The question is, a current issue that some people have is the limit of available funds and the spend downs that have limited where in relation to addiction services. Will that continue to take place?
Well, if you're talking about Medicaid, is that about Medicaid spend down?
Yeah, I think so.
So if this is a question generally about Medicaid spend down, people who are now on spend down but have incomes below 138% of poverty can become newly eligible without a spend down, as far as we understand. So they will not have that spend down problem. People whose incomes are above 138% of the federal poverty level will go to the exchange and get insurance on the exchange. So life will be very different for people on spend down. Donna, do you want to add to that?
No, that is exactly my understanding as well. It pretty much will eliminate spend down.
Spend down is still pretty unresolved. I mean, I think we're going to have to stay tuned. I think what you just heard was our best understanding, but it's been an issue that has flummoxed the federal experts as well as state experts, but I think you've heard our current understanding.
Yes.
Okay. We are now going to kind of transition into what everyone on the phone can do, and one of the questions that sort of relates to this is, other than legislators, who can the recovery community lobby?
Well,
go on.
I'll begin that, and I'm sure you'll have some things to say about it, but just generally speaking, it is so critical that the recovery community establish relationships not only with their legislators, but within their local communities, with their Adams boards, with the entire community, to make their needs and concerns known and, even more important, understood. Right now, though, to answer that question specifically, we are targeting legislators because they will be making the decisions. So, Kathy, if you want to add to that.
I sure do. Legislators, get elected for a whole host of reasons. Very few of them know very much about health care. There are a handful of health care experts. When they think of Medicaid, they think of welfare. They don't realize that this is just a program that pays health providers to provide effective care. And they also have no clue, unless they have a family member, that more of them are understanding that addiction is a growing problem in Ohio. So we do hear legislators being concerned about addiction, being very concerned about untreated behavioral health problems. What they need to make the connection between this problem and the fact that treatment works, recovery works. And nobody can tell that story the way people who are either success stories, recovery success stories, or people who work with people in a community. legislators need to hear what's happening in their own community, that there are people who are having their lives destroyed because they can't get treatment or they can't get the health care they need. They need to hear that these are their own neighbors. They also have stereotypes about who these people are. You know, these people may be somebody who had a very good paying job, who got laid off, lost their health care, lost everything, and, you know, developed problems with substance use. They need to hear the variety of people for whom this program is going to mean a transition out of a hole and into a productive life. So we can't emphasize enough the need for real stories to debunk the myths, and particularly local stories. That being said, as I said before, you know, they're going to finish their deliberations at the week of March 22nd, then go on a 2-week spring break. You've got spring break, you know, you've got all of March, including spring break, to influence them before the subcommittee votes on April 8th and the whole House votes on April 15th. So the month of March is the time to educate. How do you educate them? You can set up meetings in the district, invite them to see your program, and give them a tour. Certainly call up. You can come to Columbus. We're doing an advocacy day on March 20th. If you want to come to Columbus, we can try to schedule an appointment with your legislator. Write a letter to the editor that contains a real story in it, either your own story or somebody else's story. Get the local media to do a story about what the Medicaid expansion would mean to your program. We'd be very happy to brainstorm with you about what you can do. We also have postcards that aren't the kind of postcards you drop in a mailbox. We're giving these postcards to groups who can distribute them in a room and get them right back signed. All you do is you put in your information and you can put a sentence about why this means something to you personally. On our Advocacy Day on March 20th, we'll be delivering these postcards to legislators, district by district. And then there's an online petition that you can sign up on. If people feel compelled to, we could do a sign-on letter of people in the recovery community that specifically addresses what this means to the recovery community. So those are the kinds of things people can do. The easiest thing to do is just make a phone call on one of, you know, we send out periods. As Donna says, if you go to Donna's website, Ohio Advocates website, and sign up, if you're not already on the website, you will get alerts that ask you to take action. The easiest way to participate is to just do the actions that Donna tells you to do, and also distribute those action alerts to others in your organization and your communities. If you want to organize a community meeting, we can help you.
Yes, and as Kathy said, that is one of the easiest ways to get involved and to make your voice heard. And when you get on either of our mailing lists, you will get action alerts, and the wonderful thing about those is it'll all be there for you. If we're asking you to send a letter, chances are we will have a sample letter for you to just customize with your own story and send it off by email. So we try to be as user-friendly as possible and make it as easy as we can for you to have your voice heard. So that would be my recommendation.
Right. And you see you've got Deb Steele's email address, and you have my email address somewhere in the presentation, which we'll send out afterwards. If you contact either of us and say, I want to help, but I don't know how, we'll give you your own individual counseling support and assistance. We'll help you do whatever it is you want to do.
I think that information is actually on the last slide.
Right. You know, I can't tell the stories that I'm not personally involved in, but I'm hoping people on the phone can or know people who can. And it's those personal stories that will make all the difference here.
Mm-hmm.
So like they were saying, for more information that we have just available for you to go browse through, we have Medicaid Expansion Center on the UCAN Ohio website, and that's the short link to that you can visit. Or also on Facebook, Ohioans Support Medicaid Expansion is kind of a hub on social media for information, action alerts, results of call-in days, stories, things that organizations across the state are contributing to. And then also, like they mentioned, you can join our email lists by emailing either of those websites. And I also have a little poll that is up on the screen, hopefully right now. If you'd like to be added to our lists, you can click yes, add me to Ohio Citizens Advocates list or OCHC or both lists. And it will track the responses, and then we can automatically add you to the list rather than having you email those email addresses specifically. So take a minute to do that. Okay, thanks for doing that.
Wow.
Now we just want to thank you for participating. That's Donna's information if you need to contact her with any questions, or also their Facebook page. And then here's Kathy's information. You can email her, like just a simple email. If you want to get involved but don't know how, shoot her an email and we'll help you figure out ways for you to get involved. And then we please ask you to like us on Facebook and send us tweets on Twitter. And like Kathy said also, I'll be sending up a follow-up email with this PowerPoint, links to additional information, and some links to ways you can get involved. And then if you like this information that was presented in this webinar today, we're holding a repeat of this webinar on Monday at 3 p.m., which we'll send an email about and a link in the follow-up email. That if you have some colleagues or maybe some other people who maybe missed out on today's webinar that you'd like them to think they might be interested in participating in Monday at 3 p.m., feel free to send that around and have other people join in getting this information. So do we have any last words, Donna or Kathy, before we log off?
No, I would just like to thank you and UCAN for the collaboration on this webinar, and to thank all of you who called in today.
Yes, thank you so much. It's weird not seeing people when you're talking.
I know.
To them.
Yeah, and I just really want to thank Kathy and Donna for taking the time to present today, and like they said, to thank all the participants in today's webinar, and to be sure to email us if you guys have any questions. And really, thanks again for being here today, and this concludes our webinar. Have a great day.
Thanks. Thank you, Alyssa. Bye-bye.
Bye.